Have you ever stopped to think that your feet may reveal far more about your health than you realize? Most people take their feet for granted. We walk, run, stand for hours, wear uncomfortable shoes, deal with fatigue, sometimes notice calluses, dryness, heaviness, and almost never stop to ask, what if these changes are not just the result of age, exhaustion, or a long day? What if your feet are actually trying to warn you about something much more serious developing inside your body? And one of those conditions is diabetes. Diabetes is not just high blood sugar. It is a disease that can slowly, almost invisibly, affect blood vessels, nerves, skin, and internal organs. And very often, some of the earliest warning signs appear exactly where many people look last, on their feet. Millions of people around the world live with diabetes without even realizing it in the early stages. The disease can develop gradually over many years. A person may blame weakness on stress, thirst on hot weather, fatigue on aging, and changes in their feet on uncomfortable shoes. But during that time, the body may already be sending distress signals. Why the feet? Because the lower extremities are especially vulnerable. They are far from the heart, so any circulation problems often appear there earlier and more noticeably. In addition, the tiny blood vessels and nerve endings in the feet are particularly sensitive to high blood sugar levels. When glucose remains elevated for too long, it can gradually damage blood vessel walls and nerve fibers. This doesn't happen overnight. Sometimes it takes years, but the consequences can be severe. That is exactly why doctors around the world pay such close attention to foot health in people with diabetes. There is even a specific term for it, diabetic foot. This is not just a symptom. It is a complex set of changes that can lead to ulcers, infections, and in severe cases, even amputation. But here is what matters most. Many serious complications can be prevented if the early warning signs are recognized in time. Today, we are going to take a detailed look at alarming signals that may appear in your feet long before severe consequences develop. Some of these signs may seem minor. Some people live with them for years. But these small things can sometimes be the very first clues that your body needs help. And the first warning sign is numbness, tingling, and unusual sensations in the feet. Almost everyone has experienced a foot falling asleep after sitting in an awkward position. Usually it goes away quickly, but if you begin noticing that your feet go numb regularly, especially at night, or if you experience burning, tingling, a sensation like ants crawling on your skin, pins and needles, or even reduced sensitivity, this may be a serious reason to pay attention. Why does this happen? When blood sugar remains high for a long time, nerves can become damaged, especially the small peripheral nerves responsible for sensation in the extremities. This condition is called diabetic neuropathy. Imagine electrical wires covered by protective insulation. If that insulation becomes damaged, signals no longer travel properly. Something similar happens with nerves. They begin to malfunction. A person may feel pain for no clear reason, or on the contrary, they may stop feeling injuries altogether. And this is especially dangerous. For example, a person may step on something sharp, develop a blister from shoes, or get a small cut, and not even notice it. Normally, pain would immediately draw attention to the injury. But when sensitivity is reduced, damage can go unnoticed. And when poor healing and a higher risk of infection are added to the equation, the situation can become much more serious. Many people describe diabetic neuropathy in different ways. Some say their feet feel like they are burning. Some constantly feel cold, even under a warm blanket. Others describe it as walking on cotton. And some notice they can no longer properly sense water temperature the way they used to. Sometimes symptoms become worse at night. This is related to how the nervous system and circulation function. A person lies down to sleep, and suddenly burning, aching, or tingling intensifies. Sleep becomes disrupted. Fatigue builds. Quality of life gradually declines. It is important to understand neuropathy does not always mean diabetes, but it is very often one of its early warning signs, especially when combined with other symptoms like excessive thirst, frequent urination, fatigue, or blurred vision. That is why these changes should never be ignored. Now let's move to the second warning sign that many people underestimate: dry skin, peeling, and cracked heels. At first glance, this may seem insignificant. So what? Dry heels. Everyone gets them. Many people simply buy foot cream, get a pedicure, or use a pumice stone. And yes, sometimes the cause really is simple: weather, dehydration, aging, or open shoes. But in some cases, excessively dry skin on the feet may signal deeper metabolic issues related to diabetes. The reason is that diabetes can affect the autonomic nervous system, the part of the nervous system responsible for regulating sweating, skin moisture, and blood vessel function. When these nerves are damaged, the skin may lose its ability to moisturize naturally. Sweat production decreases. The skin becomes dry, thin, and less elastic. Then microcracks begin to appear. Why is this dangerous? Because a crack is not just a cosmetic issue. It is a break in the skin's protective barrier. Your skin is your first line of defense against bacteria, fungi, and the outside environment. When it becomes damaged, especially on the feet where pressure and friction are constant, the risk of infection increases significantly. A small crack can deepen over time, especially if a person walks a lot, wears poor-fitting shoes, or carries extra body weight. Gradually, it may become painful, inflamed, and in some cases even turn into a chronic wound. For people with diabetes, the situation becomes more complicated because the immune system may function less effectively, while circulation to the tissues may already be compromised. This means that even relatively small skin problems can heal much more slowly. Pay attention to these warning signs. If the skin on your feet has become unusually dry, if deep cracks have appeared, if peeling does not go away, if your skin itches, if your heels become rough very quickly, if painful areas develop, it is especially important to monitor the skin between the toes. Moisture often accumulates there, and fungal infections can develop more easily. Another issue that becomes more common when blood sugar is elevated. Many people do not realize that high glucose levels can create an environment where bacteria and fungi thrive more easily. This means the skin becomes vulnerable not only to damage, but also to infection. Sometimes people struggle with dry feet for years without realizing that the cause may be more serious than a lack of skincare. But this is where balance matters. Not every dry heel means diabetes. The goal is not to panic over every symptom. The goal is to recognize patterns. If dryness is combined with numbness, if unusual sensations are appearing, if cuts heal slowly, if you are constantly thirsty, if there is excess weight, family history, or unexplained energy crashes, then checking your blood sugar may be an important step. Very often, the body warns us long before severe complications develop. The problem is that many of these signals seem too ordinary to take seriously, and that is one reason diabetes is so often discovered only after it has already affected blood vessels, vision, or nerves. But here is the good news. Early detection can make an enormous difference. In the early stages, blood sugar control, nutrition, physical activity, medical supervision, and proper foot care can dramatically reduce the risk of severe complications. That is why paying attention to your feet is not an overreaction. It is a form of preventive health awareness. Look at your feet. Not quickly. Really look. Has the color changed? Is there dryness? Are there cracks? Has sensitivity changed? Are there sensations you never noticed before? Sometimes these simple observations become the very first step toward early diagnosis. And this becomes even more important because the next warning sign we will discuss is considered one of the most serious possible indicators of diabetes: slow healing wounds, cuts, and skin damage. This is often where a concerning situation can become truly dangerous. And one of the most alarming signs is slow healing wounds, blisters, cuts, or even minor skin injuries on the feet. At first, this may seem insignificant. You rubbed your heel with new shoes. A small blister appeared. You accidentally scratched your skin. A tiny cut remained after a pedicure. For most people, these kinds of injuries heal relatively quickly. The body activates its repair systems. Blood delivers oxygen. Immune cells protect against infection, and tissues recover. But with diabetes, this process can work very differently. High blood sugar gradually damages blood vessels, especially the small ones that nourish the skin, nerves, and tissues of the feet. As a result, circulation becomes impaired, and when blood flow is reduced, tissues receive less oxygen and fewer nutrients. Imagine a construction crew trying to repair a building, but the materials cannot reach the site on time. The work slows down. In a similar way, the body may struggle to repair damaged tissue efficiently, but that is only part of the problem. Elevated blood sugar can also weaken the immune system. The body becomes less effective at fighting bacteria. Even a small wound may become inflamed more easily than usual. As a result, something that would normally heal in a few days may persist for weeks. Calluses can be especially dangerous. Why? Because a callus is not just thick skin. It is an area of repeated pressure and tissue stress. If a person also has reduced sensation due to neuropathy, they may continue damaging the area again and again without realizing it. Beneath that hardened skin, hidden inflammation can develop, and sometimes a person notices it too late. That is exactly why diabetic ulcers often begin with something very simple: poorly fitting shoes, a small cut, a crack in the skin, or even a toenail trimmed too aggressively. One of the biggest mistakes people make is waiting. Many hope it will heal on its own. They apply random creams, they cover it with a bandage, they ignore it. But if a wound on your foot is not healing, becomes moist, turns red, becomes painful, or strangely, you barely feel it at all, this is no longer something to postpone. Especially concerning signs include discharge, unpleasant odor, darkening tissue, an expanding wound, swelling, or warmth around the area. These may indicate infection. It is important to understand, diabetic foot complications do not usually appear suddenly. More often, they are the result of a chain of small, unnoticed events that were not stopped in time. Now let's talk about the next warning sign: changes in skin color on the feet. Skin color can reveal a great deal about circulation. Your feet depend on stable blood flow. Blood delivers oxygen, regulates temperature, and nourishes tissue. But when blood vessels begin to suffer, the skin may start to change appearance. What should you pay attention to? If your feet become unusually pale, if the skin develops a bluish tint, if unexplained redness appears, if dark patches develop, if one foot looks noticeably different from the other, each of these changes can have different causes. But with diabetes, it is especially important to consider vascular complications. For example, paleness may suggest reduced blood flow. Bluish discoloration may indicate poor oxygen circulation. Redness can signal inflammation, pressure, or infection. Dark or black areas may be especially dangerous, as they can sometimes indicate severe tissue damage. Temperature matters too. If your feet are constantly cold, even in warmth, if one foot feels colder than the other, if certain areas feel unusually hot or inflamed, these may also be important warning signs. Some people notice that the skin on their feet becomes shiny, thin, or tight-looking. Hair growth on the legs may decrease. This can sometimes be associated with long-term circulation problems. Unfortunately, many people assume these changes are simply a normal part of aging. But the problem is that vascular complications related to diabetes can develop gradually, often without dramatic pain. This means a person may adapt to the symptoms and stop recognizing them as warnings. Now let's discuss the fifth warning sign: swelling in the feet and ankles. Swelling is not a diagnosis by itself. It can happen for many reasons: standing too long, hot weather, salt intake, varicose veins, heart conditions, kidney issues. But when diabetes is involved, swelling can become particularly important because it may be connected to multiple underlying problems. First, diabetes can damage blood vessels. Second, it can affect kidney function. Third, it may contribute to inflammation. And fourth, nerve damage and altered walking patterns can create abnormal pressure on tissues. How can you tell when swelling deserves attention? If your shoes suddenly feel tighter for no obvious reason, if socks leave deep marks, if swelling becomes regular, if your feet feel heavy or tight, if the skin appears stretched, if one foot swells more than the other, If swelling is combined with pain, redness, or heat, some people notice swelling at the end of the day and assume it is normal. Sometimes it is, but if it becomes a recurring pattern, especially alongside other symptoms, it should not be ignored. Why does this matter? Because swelling can further compromise tissue health, increase pressure, raise the risk of skin damage, and slow healing even more. Now imagine this combination: numbness, dry skin, cracks, slow healing, swelling. These are no longer isolated inconveniences. They may form a pattern. And that pattern may be your body's way of signaling that something deeper requires attention. This brings us to another critical point: footwear. When swelling, reduced sensation, and diabetes intersect, improper shoes become especially dangerous. What feels only slightly tight may create constant pressure on vulnerable parts of the foot. And if a person cannot fully feel discomfort, tissue damage may progress silently. That is why healthcare professionals so often emphasize that people with diabetes or blood sugar concerns must not only monitor glucose, but also rethink footwear, foot care, and daily self-checks. Yes, this may sound surprisingly serious, but the truth is, major complications often begin not with catastrophe, but with something small that was underestimated. A tiny wound, a hidden blister, dry skin, mild redness, slight swelling. That is why it is so important not to wait until things become serious. If you notice that your feet are changing, if small issues are becoming recurring, if your body seems to be sending repeated signals, it may be time to investigate earlier rather than later. Sometimes a simple blood test can provide more answers than months of guessing. But there are still two more extremely important symptoms that often go overlooked: pain while walking, leg cramps, fungal infections, and nail changes. These final signs can complete a bigger picture that should never be ignored. So, we've already taken a detailed look at the first 5 warning signs that may appear in the feet and potentially indicate hidden blood sugar problems: numbness, tingling, dryness, cracks, slow healing wounds, skin color changes, and swelling. Now we move into the final part: the signs that people most often dismiss as age, fatigue, uncomfortable shoes, or normal problems, even though they may actually point to serious vascular and metabolic complications. The 6th warning sign is pain while walking, heaviness, cramps, or unusual weakness in the legs and feet. Many people notice a strange pattern. They walk for a certain distance, pain begins. They stop and rest, it improves. They start walking again, the pain returns. Sometimes this is blamed on age, sometimes on just being tired, sometimes on low magnesium. But in some cases, this symptom may be connected to impaired circulation in the legs, something that can often develop alongside diabetes. When blood sugar remains elevated for a long time, not only small blood vessels suffer, but larger arteries can also be affected. Over time, blood vessel walls may become less flexible, narrow, and less efficient at delivering blood. What does this mean in real life? When you are resting, your muscles may receive enough oxygen. But when physical activity increases, such as walking, your muscles demand more oxygen and nutrients. If circulation is compromised, blood flow may not keep up. The result can be pain, tightness, fatigue, heaviness, or burning sensations. These symptoms often appear in the calves, in the feet, in the toes, or sometimes higher in the legs. Some people describe it as, "My legs feel like lead." Others say, "It feels like my calves are tightening." Some experience intense nighttime leg cramps. It is especially important to pay attention if pain happens regularly, you tolerate walking less than before, your legs tire unusually quickly, your feet feel colder, or your endurance has clearly declined. Yes, cramps do not automatically mean diabetes. There are many possible causes: dehydration, electrolyte imbalances, or muscle strain. But when these symptoms appear together with other warning signs, the overall picture becomes much more significant. Why is this dangerous? Because circulation problems are one of the major drivers of serious diabetic complications. Poor blood flow worsens healing, increases tissue vulnerability, and can intensify the consequences of even small injuries. That is why pain while walking is not just discomfort. Sometimes it is an important diagnostic clue. Now let's move to the seventh warning sign: fungal infections, itching, nail changes, and skin problems between the toes. At first glance, this may seem like nothing more than a cosmetic issue. A toenail turns yellow, the nail thickens, there is itching, the skin peels, cracks appear between the toes, odor becomes stronger. Many people simply buy an antifungal treatment and assume the problem is solved. But frequent, persistent, or recurring fungal infections may sometimes be an indirect warning sign of diabetes. Why? Because elevated blood sugar can create a more favorable environment for certain microorganisms to grow. In addition, immune defenses may be weakened and the skin may become more vulnerable to damage. Problems often develop most easily in warm, moist areas, especially between the toes. What should raise concern? Itching, peeling, cracking, redness, soft white skin between the toes, thickened nails, brittle nails, yellow, brown, or white discoloration, or nail deformity. Why does this matter? Because fungal infections are not just uncomfortable. Damaged skin and nails increase the risk of secondary infections. Cracks can become entry points for bacteria. And if sensitivity is already reduced, a person may not notice worsening symptoms right away. It can be especially risky to aggressively remove damaged tissue on your own, use questionable tools, or accidentally injure the surrounding skin. Now let's step back and look at the bigger picture. What signals may suggest that your feet need special attention? Numbness, tingling, burning, dryness, cracks, slow healing wounds, skin color changes, swelling, pain while walking, cramps, fungal infections, nail changes. A single symptom alone does not automatically mean diabetes. But when multiple warning signs begin to appear together, it becomes a much stronger reason to check your health. And this leads to the most important question: what should you do? First, do not ignore it. Do not wait for months. Do not rely only on creams. Do not assume it will go away if the issue keeps returning. Second, check your blood sugar. This may include fasting glucose, HbA1c testing, and medical consultation. Third, begin regularly inspecting your feet. Even if diabetes has not been diagnosed, this habit can be incredibly valuable. Check heels, soles between the toes, toenails, skin color, calluses, cracks, blisters, and swelling. If it is difficult to see certain areas, use a mirror. Fourth, care for your feet properly. Moisturize dry skin, but avoid applying lotion between the toes. Wear comfortable shoes. Avoid tight socks. Do not walk barefoot where injury is possible. Trim nails carefully. Keep feet clean and dry. Fifth, keep moving. Physical activity can support circulation, metabolism, and blood sugar management. But perhaps most importantly, understand that diabetes does not always begin loudly. Sometimes it develops quietly, through fatigue, through thirst, through vision changes, through skin issues, and very often, through the feet. The human body rarely stays completely silent. More often, it sends signals gradually. The real question is whether we notice them. That is why paying attention to your body is not fear. It is responsible self-awareness. Look at your feet today not as something ordinary, but as an important source of information. Sometimes just a few minutes of attention can help identify a problem before it becomes severe. And early detection is often the key not only to protecting your feet, but to preserving your overall quality of life. Because diabetes is dangerous, not only because of blood sugar itself, but because of the complications that can develop silently over time. And yet, in many cases, timely action can completely change that path. Awareness, prevention, monitoring, control. If you notice warning signs, do not panic, but do not postpone action either. Health is often protected not by dramatic decisions, but by paying attention to small details. Take care of yourself, listen to your body, And remember, sometimes your feet can tell you far more about your health than you think.